Hi, I'm Scott Wrighton. I serve as Decatur's city manager, and it's truly my pleasure every week, whether the news is good or bad, to tell you a little bit about what's going on with your city government. At the last meeting, the Decatur City Council spent a lot of time talking about something we call ARP allocation. What that stands for is the American Relief Plan. That's the Biden-era relief bill that was signed into law back in March, and it provided a significant amount of money to cities and counties and other local governments for some of their costs that are directly related or indirectly related to dealing with the economic and public health implications of the pandemic. The U.S. Treasury Department has given fairly specific instructions on how that money can be used, and of course the City Council had to make its allocation based on that. The City Council only received one portion of the tranche of money that the federal government is going to provide through ARP. The other portion will come, scheduled anyway, to come in 2022. And so they had a lot of discussion about what that should be. And in fact, that discussion began way back in May, 2 months after the bill was signed into law, when we had a clear idea about how much money would actually come to the city of Decatur. In summary, what the City Council decided is that they needed to take a balanced approach to the distribution of the funds. How can we, for example, target certain key water and sewer projects that by spending money on those, we will advance those projects to completion faster and do so in a way that hopefully will not have a negative implication on the rate that the water and sewer rates that our customers pay. They're also keen to keep up with updating the city's broadband system. For many years, broadband access was of varying quality and it wasn't considered necessarily essential like water and sewer are. But increasingly, life depends on good broadband, and so the City Council wants to make sure that broadband in Decatur, especially servicing industrial and commercial customers that are key to our revitalization, have access to good, rapid broadband. And so we are doing that both with some money from the state government through grants as well as targeted money through the ARP. And so $1 million, for example, was put into the broadband account, and $6 million for a key water project to make sure that our water quality stays up to date, $3 million into a sewer project over on the west side to make sure that we don't have sewer backups that would degrade public health. An additional $2 million and $5 more next year is for the City Council's number one priority, which is revitalization. Now, we can't just spend it on anything that we would consider to be revitalization. Again, those Treasury Department rules were very specific about what we can and cannot spend it on. It has to be related to what the Treasury Department calls housing assistance. So for us, what that's going to mean is a lot of money going into rehab of owner-occupied homes, as well as the rehabilitation of rental facilities. Either way, they improve the quality of the neighborhood. We can't use it for demolition, so we're identifying different sources for ways to increase the amount of money that we put into demolition expenses. And there were several other categories that reflected the council's view that there's not just one thing we should put it into, but many different ones to reflect their obligation to provide service over a broad area and do so in a way that hopefully keeps a lid on taxes as well as utility rate increases. One of the items that they elected to spend money on, and it was the next item on the agenda after the council had made their decisions about ARP, was to allocate about $450,000 to Dove to augment efforts we had undertaken late last year to provide rent, mortgage, and utility assistance to people who have been dislocated by COVID, people who've lost their jobs or had experienced other sorts of setbacks directly related to COVID that caused them to be behind on their utility or on their rent. The source of money that the council had used last year was channeled through the U.S. Department of Housing and Urban Development, HUD for short. And with it came a lot of regulations that I think that folks in Washington didn't really think through the implications about how their historic HUD regulations would get in the way of getting this money out to the people who really need it the most. So we partnered with Dove to spend over $500,000 for this, and they simply couldn't get it out the door. Not because Dove didn't work hard. They worked very hard, but because the regulations, the documentation were so burdensome that the people who needed it simply couldn't meet the documentation requirements imposed on us by HUD. So less than 20% of the money that the City Council allocated to Dove last year actually got out the door. So this frustrated all of us. And so our solution is to take a portion of this ARP money, which doesn't have all of those HUD restrictions tied to it, and replace the HUD money with this ARP money. And the council voted very, very quickly now that the authorization had been made for the overall ARP budget, to put that money into Dove. Now, Dove and EOC and other 501c3s and not-for-profits around the community, many of them have other sources of funds to help those people who need it the most as a result of COVID and other economic dislocations. This is just one piece that the City Council can help with and that was intended to be used, or is intended to be a use for these ARP funds. Now, the Dove staff it's only been a couple of days, so the Dove staff is still gearing up for how they will handle this. They've already developed the forms, already developed the criteria. So, and this new funding will also enable us to work with landlords. In some cases, it was difficult to get the tenant in, and the landlord was left sort of holding the bag. Now, it was recently announced in today's paper that the president had extended the moratorium on evictions that was otherwise set to go into effect this month. So that will give additional time, that's true, but I don't think it really changes anything in terms of the city's objective of trying to help people with this rent utility assistance, because sooner or later, the landlords need to receive some money for the rent that they have been not receiving for this long period of time. They have expenses, they have taxes to pay. So the sooner we are able to have this in place, whether or not there's the eviction notice doesn't go into effect until October 1st, it doesn't really change anything. In fact, it gives us a little bit of breathing room to get the program up and going. So stay tuned. I'll cover more about how some of these ARP funds are distributed and reach their intended targets in weeks ahead. The last thing I want to mention is there was also a discussion, even though it was not on the agenda at all, there was a discussion about masks because there has been an uptick in the numbers here in Macon County. What I mean by an uptick is that although the Illinois Department of Public Health numbers tend to be about a week behind, the number of cases per 100,000 has quadrupled, and the positivity rate has more than doubled. At the same time, we have seen local hospital admissions related to COVID increase. Now, the good news is there have been no deaths in that same period of time, which clearly seems to indicate that the fact that around 40% of the Macon County population has received full inoculation, and a higher number than that that's received at least one shot. What that means is that if people do get the virus, that it tends to be less severe, which probably accounts for the fact that the deaths, at least for right now, have gone to zero. So what does that mean about mask policy? Well, that has been somewhat confusing. And there are people who feel very strongly about it on both sides. Some people who feel like the masks are not especially effective, and others who feel that it is an important step to take. And maybe because there is so much division, and because the governor wanted to follow the recommendations of the CDC in a way that's consistent and easier, he has tracked with the CDC and say whatever the CDC says, and that's what we will do. And the reporting that the Illinois Department of Public Health provides and the statistics that they issue sort of track with that as well. But those recommendations, and the CDC only issues recommendations, the actual authority to implement them is with state and local government. But has been that these are recommendations for wearing masks indoors. You have to wear masks indoors if you haven't been vaccinated. If you come to the city offices, right on our doors and our elevators and other places throughout the interior of the building, you'll see a sign that says you must wear a mask. It's not voluntary. You must wear a mask if you have not received the vaccine. And that's been our position for some time now, and that's the position not only of the CDC, and the City Council has amplified that. What's made it a little bit more confusing now is that because our numbers are higher in Macon County, I think it causes us to step back and say, okay, even though it's not mandatory, are there other steps that we should be taking to make sure that our citizenry simply stays safe? So in the days and weeks ahead, as we continue to monitor these numbers, we'll take a look at those. It is certainly possible that additional requirements in certain buildings for mask wearing will be implemented. As it is now, owners of restaurants and other establishments can require it. And as we have required it in medical facilities and on public transit buses. So what I ask is that you just do the right thing to stay safe. It's still appropriate to socially distance. If you haven't been vaccinated, it's still appropriate for you to wear that mask. And the fact that some other people don't shouldn't cause you to think, well, I don't want to wear the mask. Depending on the situation that you're in, you should highly consider wearing the mask. And finally, I can't emphasize enough that although it remains a matter of personal choice and the city has no plans to require vaccinations, it remains your best defense against getting the virus and that if you did have a breakthrough case, of having a relatively easier experience with it, as has already been seen in other places in the country. So at the end of the day, we ask that you be safe, that you make good decisions, that you think about your fellow citizens and how you can protect them and keep them safe as well. I look forward to talking to you again next week.